Well, welcome back, everyone. I hope you had a nice break and got your muscles moving in your legs and ankles during the break time. So we're going to open the second half of this morning's program with our hearing from other folks just like yourselves. We're very pleased that they are here to share stories. And the facilitator of this session is Diane Tatour. Diane is a staff nurse in our anti-CoA clinic here at Mass General. And she partnered with me last year to do this program, and I'm very grateful for all of her help to put this all together, and particularly working with all of you folks, because you really are our true stars for this morning's program. So without further ado, I'll have Diane come up and she can introduce you to our patients.
Thanks very much. It is my pleasure to be able to participate again this year in the Stop the Clot Forum here in Boston. My colleagues and I have talked with many of our patients about this forum, and we've convinced a few of them to participate today, and I will say we are very grateful. Thank you for coming. We all learn something by listening to all of the experts in the field, but sometimes it's the personal stories that can really make a tremendous impact. So I'm going to start with Patty McDowell, who is a 53-year-old woman. She's married and the mother of 2 children. She had a stroke with her first pregnancy some 20 years ago and had a more recent event, and she's going to fill you in on those details. So Patty.
I was sitting alone on the couch, 28 years old and nearly 3 months pregnant, when I felt the sensation of pins and needles migrate from one side of my face to the other. Although no one was in the room, I felt the need to speak, but could not. I became anxious and began to hyperventilate. I was rushed to the emergency room of a small local hospital where I was misdiagnosed with a hysterical pregnancy and then was discharged. But as I began throwing up blood on the hospital sidewalk, I knew something else was incredibly wrong. The warning signs were there. They began with relentless nausea and vomiting to the point of throwing up bile the color of antifreeze, a 16-pound weight loss, and migraines that tended to last for days at a time. Then while driving to work, I lost the peripheral vision in both of my eyes as bright spots invaded my limited sight. However, it wouldn't be until my admission to Mass General, the 3rd hospital in as many days, when my true condition was realized. I had suffered a stroke in which a blood clot had destroyed 20% of my brain. My entire language center was gone, leaving me unable to speak, read, or write. Still, my deeper concern was for the health and well-being of my unborn child. Although it was found that the fetus was developing normally, I was now considered a high-risk pregnancy. I was put on aspirin therapy to prevent further strokes and eventually delivered a healthy full-term son, and I'm very grateful for this blessing. During my recovery, my doctor conveyed that the most significant progress is made within the first 2 weeks after a stroke, and the next milestone is the 18-month mark, after which progress is thought to be minimal. However, my inability to read a story to my son at the 18-month marker gave me the determination to surpass this milestone. Incredibly, it is now 22 years later, and I still continue to make amazing progress. I can functionally read, write, and speak, and to the layperson, I appear unimpaired. It was my mother who helped me to realize that the injuries that are not visible are the most difficult for others to acknowledge and appreciate. I know this to be true because although no one can readily see the aftermath of my stroke, it's there. I've learned many valuable lessons in my own recovery, and I'd like to share some of those most important ones with you. Reactions vary. Family and friends all react differently in a crisis. Some cry, some overtalk to make up for your inability to do so, and some cannot utter a word, just hold you tightly. You will likely have a range of reactions as well, and accepting the way you feel and giving yourself permission to feel it is an essential part of recovery. For example, during her first visit to see me in the hospital, my sister rolled herself in a fetal position at the foot of my hospital bed crying. This act gave me permission to also cry and to temporarily let down my stoic facade. Also, some visitors would speak loudly and slowly as though my hearing and intelligence were impaired simply because I was unable to express these capabilities. Although a stroke patient may not be able to speak, that doesn't mean that they cannot hear. so sensitivity is important. For example, I recall one person in my hospital room turning to another and hearing her say, "I don't know why Patty doesn't just have an abortion. This baby is killing her." Rehabilitation is crucial. Take occupational and speech therapy sessions very seriously. The more progress you make early on, the better foundation for future progress. Listen to music. I listened to songs with sentences in them as much as possible, especially when I slept, since my hearing was magnified in this relaxed state. I was told that these songs help teach your neurons to make needed connections for speech. Exercise your brain as you would an injured muscle. One main method of brain exercise is writing, so I personally set aside 45 minutes each day to write and stuck with it despite the nausea that it initially created. Support and advocacy can be a safety net. Support from loved ones can provide a sense of security during an uncertain time. Also, if you cannot advocate for yourself, it is important for trusted others to do so for you. A positive attitude gives you strength. Remember that even when things seem bleak, maintain a positive attitude and never lose hope. A positive outlook can give you strength to accomplish what others may deem impossible. The mind is powerful. I would focus on not only what I could do to survive, such as to keep solid food down to build my strength, but what I could do to overcome my challenges. I have no language center, and yet I can speak to all of you. Through years of hard work, I have trained other parts of my brain to compensate for what I have lost. Immediately following my release from Mass General, I worked with a speech and language therapist who told me that progress varies with each individual. On my first day of speech therapy, I could not recite the alphabet in its entirety and somehow thought that elemental P was a word, but eventually recovered to where I am today. I also compensate for my short-term memory loss by using an agenda book and by writing things down as I've done to deliver this presentation. Challenging yourself results in progress. At first, I began driving short distances upon my discharge from the hospital. Years later, I founded and led a town-wide project to create a playground where physically challenged and typically functioning youth could play together. I have learned that by testing one's limits, significant progress can be made, and to control what you can and just let go of the rest. Mass General recommended as a stroke victim I undergo several therapy sessions for his post-traumatic stress syndrome. During these sessions, it was made clear that the sense of helplessness I felt was common. I felt that I was a captive in my own body, meaning that I could not stop the vicious cycle of vomiting and headaches until I gave birth, nor could I prevent the stroke or its aftermath. The therapist gave me an important coping tool that I used on my first flight alone with my then infant son and continue to use today. To overcome the feeling of helplessness, she suggested that I write a letter explaining my medical condition and what the flight attendant could do in case I had another stroke, rendering me speechless. I drafted this letter, included emergency contact information, and sealed it in an envelope. When I was seated for the flight, I shared the contents with the flight attendant and placed the letter in my pocket. I felt immediate relief and surprising sense of control over my own health and well-being and that of my son. This was one of the most important steps in my personal recovery. I never felt helpless again. Then, in 2010, I suffered a pulmonary embolism while driving. In pain, I couldn't breathe air in or out of my lungs, but deemed the problem stress-related and continued the drive home. When the difficulties persisted into the second day, and I noticed pain radiating from the inner right calf, I contacted my doctor. After a series of tests, it was determined that I had a small clot lodged in the lower right quadrant of my lung. The clot likely originated in my right leg. It was also concluded that I had a patent foramen ovale, a PFO, or a small hole in the atrial septum of my heart, and antiphospholipid antibody syndrome, a disorder that produces antibodies which attack needed phospholipid binding proteins in blood, causing abnormal clotting. Despite the knowledge of medical advances since my stroke in 1989, the news was shocking, and it begged the still unanswered question: was my stroke the result of a clotting disorder or from complications brought on by my pregnancy, as was first believed? Nonetheless, I spent the next 5 days at MGH receiving Lovenox injections in an effort to reduce further incidence of clots as doses of Coumadin were being loaded into my system. Over a 3 to 4 week period, the pain in my lung and labor breathing subsided as the clot dissolved. I currently take an 81 milligram dose of aspirin once daily to guard against strokes and Coumadin each evening to reduce the risk of another pulmonary embolism due to my lifelong clotting disorder. Although my philosophy has always been more homeopathic, I'm religious about taking these medications because I know it's crucial for my overall health and well-being. These life-threatening experiences have shown me the true extent of my own capabilities and inner strength, as well as my will to not only survive, but to thrive. It is my sincere hope to convey that with a powerful human spirit, positive attitude, diligence, and perseverance, achieving remarkable things is possible. This is a philosophy that I've imparted to my children and that one I also continue to live by. Thank you.
Thank you, Patty. I think we'll move then next to Mark Vogel, who's 61 years old. He's married, has 2 children and 3 grandchildren. He's a retired salesperson for Coca-Cola and currently works part-time as a clerk.
Thank you. Thanks for having this, and glad to be participating in this, and hopefully it's a help to people. It's been very informative so far. Well, first of all, what I'd like to get out of the way is that I've worked for Coca-Cola for 31 years, and by the way, Coca-Cola does not cause blood clots. Let's get that right out there. It's been blamed for a lot of things lately in the news, but blood clots is definitely not one of them. Neither should be obesity, but that's another issue. But my story is not quite as dramatic as that, and that is quite a story. God bless you. You've done a remarkable job. One day, actually shortly after the holidays, this was 4 years ago, so I was at the age of 57, just coming back to work after a short vacation after the holidays. I was at my desk about 6 o'clock at night, working away on the computer, as normally done, and all of a sudden I took a deep breath, and I got this remarkably sharp pain in my back, and I went, whoa, what was that? I could barely breathe. And obviously it caught my attention. I stood up and I walked around for a bit. Still felt a few sharp pains when I was taking breaths. So and all of a sudden I felt, all of a sudden I was getting like a little flush, and it felt, my heart was racing. I went over to the medicine cabinet, grabbed some Tylenol, took a few of those, and I said, wow, what do I do about this? Well, I knew one thing. I wasn't continuing to work. I was going to make a decision. I would say at that point, I said, all right, I'm closing up shop for the night, going home. But the big decision I had to make was, what do I do now? Do I want to go? I live in the South Shore, so the option was, should I go to the emergency room at South Shore Hospital, get this checked out? In your mind, you're saying, we all know what it's like going to an emergency room, right? You're looking at good 3-4 hours maybe, depending on how busy it is that night, and you're saying, oh boy, do I want to do that? The only thing I could think of too is that the pain had been more across my back, and I had one other time I had a kidney stone. That was the only thing I could ever think of that was close in pain that I had ever had experienced with this. So I'm thinking, and then I'm saying, all right, I'm going home, I'm taking the drive. I'm starting to feel a little better. I don't know if I was making myself feel better so I wouldn't have to go to the emergency room. But I said, I'm starting to feel a little better. Maybe it was that Tylenol was taking effect. And I'm driving, I'm trying to make a decision. Do I go to the emergency room? Do I go home? And I remembered my wife sitting in the back there. Remember that she was babysitting that night, grandkids, so she wouldn't be home. So I said, well, if this is something similar again to what I had last time with a kidney stone, last time I needed her help to drive me to the hospital because I could not drive with a kidney stone. The pain was so unbearable. I said, well, all right, I'm gonna go and stop at the emergency room. Well, you get in there, you tell them. I should have told them I had chest pain. That would have got me done quick. I heard that's the magic words when you go to emergency room. I have chest pain. But instead I said I had back pain. So I waited and then waited. And when I was finally taken, told my story, they started doing tests. And more tests. And so I'm sitting back there. They put you in, in the room in the back, and trying to figure things out. So finally, now I said, "Oh, it looks like I'm going to be here for a little while. I better inform my wife, let her know where I am when she gets home, that I'm not going to be there." So of course I tell her. She comes running down to the emergency room, and again we had a long night. I think it was after midnight. Finally, a doctor came in and said, "We really can't pinpoint what's going on with you, and but we're going to do one more thing. We want to put you in a CAT scan." Well, they finally did that test for me, and next thing you know it, after they got the results of that, they're coming in, they're hooking me up to IVs. You're on heparin. I was told you have 2 PEs, 2 pulmonary embolisms in your lungs. So, quite a shock there. I had to move real quick into things, into action. They were moving fast, and all of a sudden, well, we're admitting you. You're not going home tonight, But, later on, you come to find out, according to the doctors, like they said, that was probably one of the best decisions I ever made, because they said, God forbid, if I had gone home that evening, you never know the way these things operate as they go through your lungs and heart. Something very bad could have happened. So I would say, I went through I was in the hospital. They get you on the heparin, trying to get your INRs ready, and then obviously you want to get out of there. And that's the next thing. What do you do? I want to go home, start living my life normally again. But to get home, I had to go on the Lovenox. So it's part of the transition into being on warfarin. So, and again, when I'm in the hospital, one of the biggest things about this was, of course, you get asked the questions like, did you have recent surgery? Were you on a long trip? Did you go on a plane trip? Were you, laid up in bed, anything? I had nothing. No signs, preconditions for this to seem to happen to me. So, and now as I'm following up later on, and one of the things that's funny when it was talked about earlier in one of the presentations was one of the options when I was in there. I remember with the hematologist talking to me was about the possibility of putting in one of those filters, and that was a decision that I had to make at that time. And again, they gave me the pros and cons, and again, the hematologist at the time said he probably would, err on the side of probably not putting it in, which I'm looking at after what was presented today. That was probably a good decision, not having one of those filters put in. But so at the time, so that was one of the decisions I had to make. And so then again, so now now your whole life has kind of changed. You're on Coumadin therapy, now it's trying to get your INRs regulated, constant blood testing, I travel to the South Shore Hospital, even though I'm managed here from the AMS clinic here at Mass General. I get my blood test done at South Shore Hospital since it's a lot more convenient for me. But it's constant, and and then you follow up. I was following up with my hematologist, and after being on, and he did all these tests too to see if I had predisposition to blood clots, because they couldn't figure out what the cause was. All the tests came back negative. I didn't have the factor V. I didn't have these other preconditions. So after treating me for about a year, going back and seeing him, he came to me and said, "Listen, there's really, at this point, we can see no reason why you couldn't come off the Coumadin." He said, that they can't find any reason. It doesn't seem to have any predisposition for it. So he said, you could probably come off. So that was my next big decision to make. Should I come off the Coumadin? Well, after consulting my primary care physician, Dr. Alan Pinedo, who happens to be here at Mass General, when he talked to me about it, he said, pros, cons. And again, if it was me, he said, I would probably stay on it, because to me, it's like he said, it's almost like an insurance policy, Like, say, what's the risk factors? He said, like, if I was older, maybe in my 80s, close to 80, the bleeding factor might be outweigh the other factors. But he said, given my age and everything, he said, if it was me, I probably would stay on it. So that was the big decision I had to make. So I have stayed on the Coumadin. to give me a little more peace of mind. Even though there are other issues like we've talked about, dietary issues, drug, medicine interactions. So obviously, some of these new drugs, especially the one that we just talked about, obviously piqued my interest a lot because it certainly would make life easier, obviously coming off. But so some of these things we have to weigh the risk of. Something like the bleeding issue, how you can't reverse it if something traumatic happened. And the other thing now to take into effect is the Clots. Have to look into that, the Clots, and see if the insurance would pick it up at all. But that would be the big decision for me going forward right now, is to see if maybe to go on one of these other drugs. But that's basically it. That's my story.
Thank you very much. Next is Rachel Monahan. She's 33 years old. She's married, has 2 young children, toddlers and infants still. And she's also a medical malpractice attorney, so we'll let her tell her story.
Okay. Oh, everyone loves lawyers. Yeah, thank you. I have an 18-month-old son and a 4-year-old daughter. My experience just happened. Sure. Is that better? Okay. My experience just happened this past June, so it's very recent. My story, I don't know, is as dramatic, but essentially it was a Saturday morning. I was with my 2 young children visiting my parents in New Hampshire. Very similar. I started to feel pain in my back between my shoulder blades. When I take a breath in, it would hurt in my chest, but nothing that really felt, I need to run to the emergency room or something like that initially. My mother, who's Italian, said I needed to eat. So, kind of waited out for a little bit, and eventually you know yourself, and something just wasn't right. I sat down, had a couple of episodes where I felt like I was going to pass out but didn't. So ultimately I went to a local emergency room. It took a while with a diagnosis. I had a blood test that indicated I had a clot. I had a CAT scan done. The initial read came back as negative. They couldn't quite figure out what was going on with my vitals, and I was admitted. By chance, and given my background, I asked for a second read on my CT, and they found it. And subsequently, I was here at Mass General. It's one of those things that I think, as far as the decision to go to the emergency room and stressing it, one of these things we feel as patients, am I anxious? Am I going to get the hospital? They're going to think, am I a hypochondriac? Or all these things that go through your head. And I think I am, again, my job. I have a headache, and I think I have a brain aneurysm. So, you have to keep it all in check. But ultimately, I think it's so important that when you have these sort of symptoms, whether they're amorphous, just get it checked out and ask questions. And I think that's really hard as lay people sometimes to be sure to ask questions. And I will ask, I'm worried about this. When I went in, I thought, am I having a small heart attack? I thought of a pulmonary embolism. I'd just been working on a PE case, actually. And what are we doing to diagnose this and rule this out? And it's sometimes hard to ask those questions, but I always find that physicians love answering those questions. And I think if you find a physician that doesn't want to answer those questions, you find someone who wants to, no matter how crazy you think that you might be. Subsequent to that, of course, I'm sort of early on in this, so I am on Coumadin right now. I have been offered to go on the other drug. And I think for me personally, I'm comfortable with Coumadin. The big problem that I personally feel is the reversal effect that still sort of bothers me right now. But listening here today, there are other benefits. So I don't know. It's a hard decision. And I think ultimately, they don't know for me what the cause of the clot was. Most likely attributed to the birth control pill, but they're not really sure. So from June to December, in December I have to make a decision. We'll do more tests and figure out long-term what it'll be, and I might have some more consideration then. But for now, I'm more comfortable with warfarin. And again, I don't know if this is normal or not. For me personally, once I started on Coumadin, I live on the North Shore and I commute to Boston every single day for work. and you start feeling more anxious. What if someone hits me and I'm going to bleed out? My husband notices, who also works in Boston, and I'm probably a backseat driver anyway, but he's like, you're really jumpy, and I'm sure I drive him nuts, but I can't help it. I'm feeling anxiety from that, and I have talked to a few other people that have had the same experience and have been on this drug and feel the same, so maybe it's not completely out of ordinary, but it definitely affects your life in that mental aspect too, and I think it's helpful to know that other people feel that way. They're serious drugs. So that's where I'm at right now. We're still trying to ensure as to what I should do in the future and figuring it out, but I just really wanted to be here to send the message that if you feel any symptoms or you have any doubt, no matter how crazy you think it is, make sure you have those communications and talk and ask. And at the end of the day, if you go to the emergency room and you waste some time, but isn't it great to go home and nothing's wrong and you have the peace of mind?
Thank you, Rachel. And Madeline Wilson is going to be our last presenter today. She's 67 years old. She was diagnosed early in the 90s with antiphospholipid antibody syndrome. She's married. She has 2 children. And she's a developmental officer. And I'll let her tell you what that is.
It sounds like I'm still developing. A fundraiser. I was a development officer, a fundraiser. I had my diagnosis, as was said, in the early 90s, 1991, of antiphospholipid syndrome, and it was secondary, as it turned out. I'm monitored now by my wonderful Irina, who is at the phone if I need her with any crazy question, and it's so nice to be able to get a person when you call MGH. It's really nice. And she's wonderful. My history before I was diagnosed, and of course we're starting in the late 70s through to 1991 when there was still a lot of research going on. I had temporary loss of vision off and on, and I had dizziness, migraines quite frequently. I had periodic numbing of my one side or the other, hands and tingling in the side of my face. These all, I didn't stay at home for these. I mean, a lot of these went to the doctor, and I was in New York at the time, and remember, it was the 60s, and the New York doctor said, "Oh, you're just on the fast track." And I thought, no, this is something different. So it just went uncared for in many ways. I had lacy rashes on my knees and my elbows, which kind of intrigued doctors, but they didn't know what to do. I had 3 miscarriages. I had 1 premature son who is still with us today, and I had a stillborn birth. And that was before being diagnosed. I never talk about this, so this is really hard for me. During the beginning, trying to sort it all out was horrific. We were in New York, and then we moved to London. So we sort of started from stage 1 in London, not knowing anything was wrong other than I could not get pregnant again. That was what was told me. And so we went. I was lucky. The doctor that I got to see was Graham Hughes, who is very responsible for the creation of the research, I should say, of the antiphospholipid syndrome. And when I was under his care, my vision kept going. I kept getting these periods of losing consciousness and slightly disorientation. And I finally had a grand mal seizure. And the first diagnosis was a seizure. They called it epilepsy at that time. And I took anticonvulsants for it, and I had to be desensitized to the anticonvulsants because I had reactions and rashes or breathing with a lot of them. So I started taking that. That stopped the grand mal seizure, but I still had partial seizures. And so therefore, I wasn't driving or anything. And then from there, we went to, one day my face swelled for no reason, and my doctor said, I think we better check, do some lupus tests on you. So I was diagnosed with systemic lupus at that point. My vision kept on going in and out, and then one day it went completely in my left eye, and that was a blood clot. And from then on, they put me on warfarin, and I was on warfarin for 2 years when I had a stroke. And so I was then bumped up to getting my INR at a higher level than that. And then I moved back here, and I had another stroke. It had nothing to do with Boston, although I wanted to stay in London. And I went to, started with Mass General, and now my blood is kept at a very thin level. I have to have it done once or twice a week, because it does exactly what the doctor was saying. It peaks and falls. I'm on it, and for no particular reason. And so I'm here a lot. I prefer that, actually, because I get to, again, talk over how I feel with Irina, and that means a lot to me. The things you said about when to call the doctor, that's always really hard. But I think as the time has gone on, I have begun to know my body. And a red flag goes up for you. There's no question. All of a sudden you say, wait, that's not kidney. You know, it just goes up for you, but it takes time to get to know your body. In getting to that point, you need to do just what Rebecca said. Badger your doctor as much as you feel you want. Get the answers you want. Bring an advocate with you if you do not yourself want to be in the position of badgering the doctor. Bring someone with you. And always, always try to separate, and this is the hardest part, separate yourself from your illness. Don't be Madeline Wilson, that ill girl. I try to put Madeline Wilson here and my illness here, and when I can do something about my illness, I bring them together. Most people don't want to hear about it after the first, oh my God. Then they don't want to hear anymore. And you can see it in their eyes. They're drifting, or they're looking for the person behind you. You have to make sure you have one person that you can cry on their shoulder. That's important. But, and it may even be your doctor. But you have to make sure you have one person. But don't let it, for any reason, stop you from doing everything you want to do. Feeling emancipated to bring a letter on an airplane, which is what I have done. Traveling to a foreign country and finding out in Italy where I can get my blood done, and having the test results come back here. I mean, all of these things are possible. You don't have to stay married to your doctor or to your lab or to your blood tests. We have, all of us have something that is wrong with us, but we're all here today, and we'll more than likely be here tomorrow. And we should all try to do the best that we can in between those times. That's the only way I can make it work for me. Thank you.
Thank you, Madeline. So we have a few minutes left. If anyone in the audience has a question for any of our panel participants.
thank you for your presentations. What I draw from your presentations is your desire, your vow to fight it off. And that's, I believe it is the most positive to say, I fight it off, I'm going to win. Thank you.
My question is for Rachel, was it? I have a similar situation where they said, we don't really know, but we're going to go ahead and blame the birth control pill. How long are you going to accept that? Or are you going to go after more answers? Or
I am. And I have a great hematologist here that I'm working with. And the plan right now for me is to stay on Coumadin for 6 months. At the end of 6 months, I am going to come off for 2 weeks and do another panel of tests. It's hard to get a lot of to the underlying causes, of course, when you're on Coumadin because it can alter test results, is my understanding. So at that point, and I'm thinking about it now, but that's sort of where I'm going to concentrate. I'm trying not to obsess over it at the moment because I know we're obsessing a lot about what happened, and it's stressful that way. So I'll make my decision at that point, make sure I'm surrounded by physicians that I'm very comfortable with and trust them. So that's where I'm at now, and that's what I think works for me, you know, and when we come to that point. Good luck.
My question is for any of the women on the panel, and it's probably a really ridiculous question, but how do you shave your legs? With what? Shaving.
Wax. Wax.
You use wax?
Get them waxed.
Get them waxed?
Belisante, Newbury Street.
Okay. Does everybody agree with waxing?
I would add electric razors are fine, but I also would say safety razors are fine. Don't be in a hurry. Use some shaving cream to make it nice and smooth. And if you're a little unsteady on your feet, sit down in your shower or make a nice luxurious bath for yourself. But you don't have to shy away unless you're really nicking your legs all up. But a safety razor would be okay. Take your time. It doesn't work.
No,
Just
safety, I'm sorry, the electric shavers don't really.
Oh, treat yourself to Belsanto. You'll love it.
My question or comment, I guess, is to the last speaker, and I apologize for not remembering your name.
Madeline.
Madeline, I was diagnosed 4 years ago with antiphospholipid syndrome after suffering from bilateral pulmonary embolisms at the age of 40. And I have just recently been taken off of warfarin because my INRs were swinging from anywhere from 0.9 to 8.1. So the hematologist has taken me off of everything right now, which is temporarily. I've been off it now for 2 months, but it's extremely unsettling to me to not be on anything and to still have antiphospholipid syndrome. So I feel like I'm sort of stuck. I was in an anticoagulation clinic and was taken out because my levels were just, you know.
Were you having your blood tests weekly, bi-weekly, or?
I'm not having anything done right now.
No, when you were.
I was having it done weekly. I was testing at home. I'm sorry. I was having it done weekly. Twice weekly, I was testing at home. They tried me on Xarelto and then took me off of that, put me back on warfarin. So I sort of feel like I'm drifting right now, and I guess I'm just wondering.
I mean, I'm not a professional, but
Right.
when mine has swung like that, and I've gone to 8, and then you know, when you're at 8, you rub your eyes and you start getting too black eyes. I've always felt that it could be, and it was like this in England, but now with the anticoagulation management clinic, I sometimes have it done twice a week, and it's done from my arm. They say that that's the most accurate reading for that. It's not the finger. And so I come in, I'm lucky enough, although I've gone to clinics when I've been out of town. I mean, but I'm lucky enough to live nearby so I can come in. But it's an immediate reformulation. I mean, it just is, and for me, I was a little unclear about what was said this morning about it taking so long for warfarin to work. I'm not really, I don't think it takes so long for it to work. And if you're at 1 point something and you're in here and they give you the results, I mean, maybe it is a matter of you going in and getting the heparin injection and then starting the warfarin again. I don't know, but it doesn't seem, I'm not a doctor, but mine does the exact same thing, and really for no reason. I mean, vitamin K, yes, when all the fresh vegetables are in the summer, but Irina and I just say, okay, well, then do this, let's do this, and let's try that. And it seems to get me down, at least. I haven't hit numbers like 8 point something in a long time.
I think the concern was that it was the antiphospholipid syndrome that was making things difficult, and they're not sure what to do with it, so we're not doing anything right now.
I think if, perhaps that question might be addressed a little bit by our next speaker, who deals a lot with women who have clotting disorders. So we might just park that until we hear what she has to say. Any other questions? Well, I thank you all very much for participating today. You did a wonderful job.